Okay, good morning, everybody, or good afternoon. Welcome to the Lupus Foundation of Northern California's office hours with Dr. Parsa. And it's been a few weeks since we saw everybody and scheduled this event, so it's great to be back and hope everybody's doing well. Good morning, Dr. Parsa. Great to see you too, always.
Good morning, Jay. Good morning, everyone.
And just as we go through the office hours here with Dr. Parsa, we have a couple questions that have come through since our last YouTube live event. So we'll hit on those up front, and then any questions that you have during the office hours or even after our office hours here. We'll spend about 30 minutes, but if we have more questions, we can definitely go over. So please, you can either email your questions here behind me to communications@lfnc.org, or you can also put questions through our live YouTube chat, and I will see those questions and we can answer those questions live here with Dr. Parsa. So with that, we will jump in. We've got three main questions that we'll talk about. One is Dr. Fauci and the CDC recently came out this week with some questions around and recommendations around goggles and more face protection other than just the masks. So we want to talk about that. Been several questions come through around the latest with lupus patients for hydroxychloroquine, or better known as Plaquenil, as well as vitamin D. And so we'll hit on those three topics. And then we want to announce also a new program with the Lupus Foundation and Primary Care to You, especially for those that would want to have more access to primary care and access to Dr. Parsa outside of these office hours. And so we'll talk about that at the end. So again, if you have any questions here during the event, feel free to email us at communications@lfnc.org or put those questions through the YouTube live, and we will get started. So let's see here, Dr. Parsa. So since there's a lot going on every week, every day, it seems we're getting more information coming out. We're learning more and more about not just the treatment of COVID, but the impact it has, potentially on individuals more so than other individuals. And so this week, just a couple of days ago, Dr. Fauci and Dr. Birx from the White House COVID response coordinator put out an article recommending that in addition to masks, right, for additional protection to also wear a shield or even goggles, and wanted to get your thoughts on that latest, research and recommendation that's come out this week from Dr. Fauci.
Sure. I want to just review, how the COVID virus would be transmitted. As we know, it's a person-to-person spread. There are two ways that, the viruses can just transmit from one person to another one. We have the aerosol, and we have the droplets. We know that, so droplets are the bigger particles that they're just, for someone who got the COVID, they can just, have the COVID virus in their oral nasal, mucosal layer. And anytime they're sneezing or coughing, these droplets just, would be getting out of their system and just go to the, they're just because of the gravity, they would just eventually drop on the floor. We know that the 6 feet is almost the safe distance for the droplets to be transmitted. So there was some numbers in some states, even with the patients who were using the mask, the number of the COVID numbers and the number of the patient being contracted COVID just went up. So there is another question. They're thinking that there might be some role of the aerosol, which are the smaller particles that they can also contain some viruses, and they can stay on the air and lingering on the air for a longer time. So Dr. Fauci just recommended that we have to consider to just using the goggle on top of the mask that we're using in order to prevent for the aerosol to be transmitted to another person. Of course, there are more study needed to be done to just exactly know the role of the aerosol and at what size of the aerosol it would just increasing the chance of the transmission. What we can recommend at this time, if we know if you're in contact with someone with the COVID and you have available face shield, it would be useful to just use the face shield while you're just in contact with the COVID patient positive, close to you or in your household. Until more studies coming, CDC hasn't recommended or just, publishing like the guideline that everyone should just using the face shield. But, as Dr. Fauci just mentioned, there's some studies questioning that maybe aerosol is also as important as droplet for the transmission of the virus. So we'll see, in the next coming weeks, we're going to have more information. And of course, the CDC is going to give us, better and clear instruction for the face mask. But for now, it's a consideration due to the transmission through the aerosol and not just the droplets, which aerosol, as we mentioned, are smaller particles than droplets that they still can just carry the viruses. The other thing that is very important, make sure that the ventilation of the system, and if you have a patient with the positive COVID, make sure that the room or the place that the patient is staying have a good ventilation, open the windows and the ventilation working, because that's another way that refreshing the air. And if there is any aerosol, in the air, would be cleared through the good ventilation. For now, again, precaution, keeping the distance is the universal protection that is being recommended by the CDC, but there is a possibility based on what Dr. Fauci was taught and proposed that, we need to have a face shield and face mask, especially if you're in contact with the COVID patients at home or close to you.
Great. Thank you, Dr. Parsa. Yeah, that's helpful. And I guess, you can never be too careful, in these times. So especially if, you may have some sort of, autoimmune disease such as lupus and so forth, or any other type of health condition, it's I guess you can never be too careful. So very helpful. Thank you for explaining that. One of the other things that's been coming up, and we've had a few questions, and there's been a lot of research, and most recently is around vitamin D and levels of vitamin D that are low, but also if tying vitamin D to your immune system and your ability to fight, flu and so forth, influenza and COVID. So there's been some studies in the last, several months, and most recently, even in the past, week, we see them coming out as far as a correlation between vitamin D deficiency and severity of COVID patients, or patients that get COVID tend to have a higher severity potentially if they have a low vitamin D level than if they have a safe vitamin D level. And of course, as lupus patients, not recommending to be out in the sun being one form of getting, vitamin D, absorbed in your body. But for lupus patients, that's always a challenge. So wanted to get your thoughts as far as, your recommendations around monitoring your vitamin D level and what you do with patients to help them boost their vitamin D, and what is a safe level or a recommended level.
That's a very good question. So since our audience is our lupus patient, I want to make sure that our patient just be careful about the sunlight, because as we know, the UV ultraviolet in the sunlight is responsible for the cell damage and cell breakdown, which is making the immune system exposed to the content of the material inside the cell, including the nucleus inside the cell. So we always recommend the lupus patient, when they're going outside, they're going to the beach, or in the sunny days, make sure they have the good protection with the sunscreen, especially with the SPF above 90, because we want to make sure that we like them to have the good vitamin D, but probably not the best way to get it through the UV light for the lupus patient, because it might just causes the flare of the lupus. So, but as far as the vitamin D is being known for many years, and there are more studies coming and confirming the role of the vitamin D in modulating the immune system and how it reacts. In the autoimmune disease, as we know, our immune system, instead of just fighting the viruses and bacteria coming to the body or defending the body, by mistake, they're attacking their own host cells. So vitamin D is having the modulation to control over the immune system, to just recognize the self versus the outsider. So we know that, in many other diseases and many other condition and infectious disease, the vitamin D deficiency making the immune system goes to the chaos. What does that mean? That, when the particles or a bacteria or a virus coming to the cell, it would be recognized and would be picked by some of the cells, we call it macrophage. The macrophage ingesting them and presenting them to the immune system. And vitamin D has a role in that transmission between the cell when they're communicating to just say, hey, this is the particle, it's not supposed to be in the body. And when the vitamin D is not available, the immune system might just, reacting aggressively more than it's supposed to do and being propagating to the whole body and causing something, we call it cytokine storm. Cytokine storm is happening when the body is just producing a large amount of the chemicals, which is, like a warning to the whole body that we are dealing with a very bad condition. And we know that the vitamin D deficiency and the vitamin D has a role to just, make sure that this system is not being used unnecessarily. There was another thing that we mentioned in our previous, webinars, that the two level of the vitamin D normal level is between 30 to 100. The immunomodulation or the immune cell effect of the vitamin D happens, the vitamin D is above 50 and above, 50, 60. So we have to make sure, number one, our vitamin D to be checked by our physician, make sure that the number is above 50 by the supplementation. We still don't know why the vitamin D deficiency is so common nationwide and not internationally, the whole world. There is a pandemic of the silent vitamin D deficiency, and we know the deficiency of the vitamin D is not good for the immune system, for the people with the autoimmune disease, especially with this time that we are dealing with the COVID. And our fear and our concern is the severe form of the COVID, which the patient needs to go to the hospital and might need the intubation and extra oxygen to be delivered to the body. Also, we know that the viruses would attach to the receptor by the name of ACE, and vitamin D is also modulating the presentation of the cell, how they're just presenting their ACE receptor. So there are still studies coming new. Some of the new studies from other side of the world confirm that the people who has sufficient amount of the vitamin D, which as we mentioned is above 50, are more protected against the severe form of the disease, and they would be able to manage the virus when the people contracting them, to manage them without going to the cytokine storm, which is our fear and our concern. So, and general health for the vitamin D is, we know that is contribute to the calcium, bone, and other things that the vitamin D does. So general rule is we want to make sure that, our patients, especially with the autoimmune disease, is also autoimmune disease is the dysregulation of the immune system, handling the immune response. So generally speaking, and with a lot of evidences behind, of course, we need more studies to come to just, make it as a guideline for everyone to be checked on a regular basis and make sure that we're maintaining our vitamin D to the sufficient amount to be able to protect our body against the foreign viruses and bacteria, and also not letting the immune system to be reacted in an improper way, that what we call it autoimmune disease. So if I want to just, overall with all the studies that we have, all the publication that we already reviewed, we recommend that the patient taking extra vitamin D, if their vitamin D is low, and have a maintenance level of the 5,000 daily until we know and we get to the level that is safe and good for the body and the general health and well-being.
Great. Well, thanks, Dr. Parsa. Yeah, so it sounds like above 50 is where we want, vitamin D level to be in the safe zone, if you will, as far as your blood work above 50 on vitamin D. And then, so if you are low, it sounds like 5,000 IU per day dosage until you get above 50 is the recommendation.
That is correct. And
Okay.
if it's very low, the doctor also look at the number. They would give them also the 50,000 weekly on top of the 5,000 daily to bring it faster to the level that is in the safe number. But if yours is not too low, it's like 30, 25 to 35, you still want it to just bring it above the 50. So we're keep taking it until we get to the level of the 50 and above. And then once we get to that level, the 2,000 units would be enough to maintain that level. Still needs to be taken every day, because if you stop taking the supplemental vitamin D, it would drops again. I saw that in many patients that they were taking it, they took the 50,000, they take the 5,000, the number just got above the 50, and they stopped taking it. And 2 months after we checked it, it dropped again. So we want to make sure that the patient is still taking the maintenance to keep that level above the 50.
Okay, great. Yeah, I mean, there was I think it was Stanford came out with a research just a couple of weeks ago about vitamin D, and it's estimated that almost over 40% of the U.S. population has vitamin D deficiency. So it's quite common. So thank you for sharing. Thank you for sharing your thoughts there. Hopefully that's helpful. And again, for anybody that's watching us on YouTube, feel free to email questions over to communications@LFNC, or you can send it through the chat and in the YouTube live chat, and we'll answer those questions here. So moving on, next question. We get a lot of questions at the Lupus Foundation around hydroxychloroquine, the availability of it, and so forth. I will say, as far as the availability of Plaquenil or hydroxychloroquine, there's the Wellness Pharmacy in Los Gatos, on Los Gatos Boulevard and Highway 85. Dr. Kwong is the pharmacist there. They do have hydroxychloroquine in stock. So if anybody is in need or you're not getting it, feel free to reach out there. If you have questions, you can also get this information on our website, lfnc.org/COVID-19, up here behind me. So one of the questions a couple questions that have come through in the last week or so, Dr. Parsa, from our lupus community is, can hydroxychloroquine protect you or protect you from COVID or prevent you from getting COVID-19? There's a lot of information out there in the news and so forth. And what are your thoughts and recommendations around hydroxychloroquine, and can it will it protect you from getting COVID or prevent you from getting COVID?
Very good question. Again, in June 2020, the CDC stopped using the emergency use of the hydroxychloroquine or chloroquine for the severe form of the COVID hospitalized patient, for the lack of the clear benefits and potential toxicity for the patient, especially if there are higher dosage. And as we know, chloroquine is a pretty safe medication if we check, the patient's other medication, because there's one of the potential side effects of the chloroquine is that it might, it would increase the distance in the EKG form. That's something we call it QT, which is the two distances of the part of the EKG that could potentially causes arrhythmia. Of course, if you're taking it with the previous EKG and the doctor monitoring it, it's still safe. But there are several studies. Some of them hasn't been published yet, but actually was randomized. I will review what is the randomization means. There's studies that you read on the Google or you search. Some of these studies are the observational studies. Basically, in one hospital, they're checking with the people that they take, like medication A, and they saw, based on the result, there is some benefit potentially might have that medication. As we know, there is some of the things we call it the biases would be affecting those numbers and those results and the conclusion that we can get from that study. And if we're not randomized the studies, those are not valid to just, that's being to get a conclusion out of it, and just creating the guidelines and coming up with the guidelines. So far, all the studies, most of the studies that has done all around the world, including the US, didn't show any benefit that the chloroquine or hydroxychloroquine preventing getting the COVID, or preventing having mortality, or shortening the hospital stay. Actually, some of them also showed there is bad consequences of taking it. But the bottom line of all the studies has done is there is no clear benefit of the chloroquine or hydroxychloroquine for the prevention, or for the decreasing the mortality or the hospital stay so far. For that reason, CDC, NIH, and WHO stop observing and running more studies with the hydroxychloroquine. So this doesn't mean that the patient on the chloroquine are at risk of having side effects of the COVID if they're just contracting the COVID, but we're not recommending it anymore based on the data that we have so far, that there is any clear benefit of the chloroquine or hydroxychloroquine. But if you're a lupus patient or having any autoimmune disease and you're taking the hydroxychloroquine, continue taking it. If you're taking other medicine besides the chloroquine and hydroxychloroquine, if you're in contact with the positive COVID patient, or you start having some symptom, you definitely need to just talk to your rheumatologist or your primary care physician through the telemedicine and consult with them, because not for the chloroquine or hydroxychloroquine, for other immunosuppressant medication like azathioprine, or other medication, the cyclosporine, they might just holding on those medication. If you have any symptom, we have to make sure that, because some of the symptoms of the COVID and the lupus flare are just a lot of similarity between it, between these two, and it's very difficult to know, are we dealing with the lupus flare or is it the COVID that's coming? And it's very difficult to know. So anytime that you have any new symptoms, make sure that you contact your primary physician or your rheumatologist or healthcare provider to just see what we need to do as far as your medication. But if you're on hydroxychloroquine, continue the hydroxychloroquine. It's not causing any side effect of being the maintenance dosage while you're taking it. But there are other medications that are immunosuppressant. They might be getting off your list of the medication you're taking. So number one thing, you just make sure if you have any symptom, contact the healthcare provider to get the advice for medication.
Great. Thanks, Dr. Parsa. The other question around hydroxychloroquine is, that's come through from our community is, should patients start taking it, and should they take it without a prescription? There's been a lot of information out there about getting it at the pharmacy and so forth, but what are your thoughts and recommendations around taking hydroxychloroquine without a prescription or without seeing a physician?
Definitely not. That's a very unwise thing to do, to take the hydroxychloroquine. Our goal in the COVID is we want a patient. So a lot of people would get COVID and they would eventually get better, like any other viral disease. The initial thought with the hydroxychloroquine is to preventing it not to become the severe form of the COVID, which all the studies so far didn't show any benefits. By adding a medication which doesn't have the clear benefit, you're just adding the potential toxicity, especially if you don't know, you haven't done your EKG before, you might be at the risk to just get some arrhythmia because your QT might be already being prolonged. And by taking the chloroquine or hydroxychloroquine, you're even making it more prolonged. So you're accepting or adding more risk without any potential benefit that you're adding to. Of course, cost is two things: the amount that you pay and the side effects of the medication. So definitely I wouldn't recommend to take any hydroxychloroquine for the outpatient who might or we're suspicious having the COVID. Even for the severe form, as I just explained that, the WHO, CDC, and NIH already just stopped, doing more research on the chloroquine or using it for any potential benefit of the hydroxychloroquine. So far, the studies didn't show any support of this. And for the outpatient, definitely not, because you're adding a risk without any potential benefit. So of course not.
Okay, sounds good. Yeah, that's definitely sounds logical. You should definitely see a physician before starting to take any type of medication. One question that came through our YouTube live chat here, back on vitamin D. So the question is there a difference between vitamin D3 and vitamin D?
So vitamin D has two different forms, D2 and D3. When you go to the sun and getting the UV, of course, we're not recommending it for the lupus patient. The body and the skin producing vitamin D2, which is the precursor of the vitamin D3. In the body, the vitamin D2 would be converted to the D3, and then would be some other chemical would be added to the vitamin D3. That's what we call it 125 dihydroxy vitamin D3, which is the active form of the vitamin D that has major role in the immune system and immunomodulation. So vitamin D, when we're talking about the vitamin D, we're talking about the active form, which is the vitamin D3, which you can find it in the stores. And basically that's the active form of the vitamin D that you have to take, because sometimes because some people say, I don't have the lupus. If I go to the sunlight, am I getting enough the vitamin D? Yes, you're getting enough of the vitamin D2, but the vitamin D2 needs to be converted to the active form, the 125 dihydroxy vitamin D3, which there's some of the enzyme in between are involved. So you might have enough of the D2 and not enough the D3. So we recommend taking it, by taking the vitamin D3 as like the pill. This is the safest way that you can absorb of the vitamin D. There is also a problem with the absorption of the vitamin D. For whatever reason, we still don't know and is not understood well. The vitamin D wouldn't be absorbed enough. And the other negative effect is we noticed and we found that in patients with the severe deficiency of the vitamin D, even the absorption would be slower than normal, which is supposed to be the opposite. So that's why the much higher dosage, like the 50,000, would be helpful to just be able to, with the slow absorption in the patient with the severe deficiency, to make sure we're getting enough of it. Outside the United States, also the injection form of the vitamin D3 is available, but we don't have it in the United States, which is the safest actually way of getting the vitamin D, because the absorption not playing any role here. So if the patient is not absorbing it well, we can give it through the injection, which gets to the body and to the system and start working. So bottom line is, if we are dealing with the vitamin D less than 20, definitely your physician should give you the 50,000 weekly on top of the 5,000 daily of the vitamin D3. And D3, when we're talking, is the active form of the vitamin D3, not the D2, which would be produced by the sunlight to our skin.
Got it. Okay. Yeah. So for patients or for the supplement, if they go to the pharmacy or Walgreens, CVS, what they want is the vitamin D3 is what
Correct.
They want for the
You
supplement.
can also order it through the Amazon as well.
Yeah. Okay. Great. Thank you, Dr. Parsa. Okay. So I know we're up here on the half hour. We wanted to also introduce, we've had questions that have come through regarding just primary care, especially if you may have insurance, may not have insurance. What do you do, especially for lupus patients? And Dr. Parsa, and with the Lupus Foundation, we wanted to introduce this primary care to you program. And let me just share my screen. And wanted to bring up just a couple slides here to share with you. We'll also put this up on the YouTube as well as our website. And you can see it there as well. Let me go into present mode here. Move my Zoom bar. So this is a new patient program. It's primary care to you, and we wanted to share this. It's with our community, and It's really a way to access Dr. Parsa through telemedicine at a very reasonable, with a very reasonable program. And a little bit about it, you know, from a Lupus Foundation point of view, you know, we've had a lot of interest around, especially if you don't have insurance, how do I access primary care physician for, you know, referrals or a specialist, or just to answer questions you may have, you know, during your just day-to-day routine, or, you know, when you're not feeling well and so forth. And so we're happy to introduce this through the Lupus Foundation and with Dr. Parsa. And a little, just, won't read the slides to you. We'll post this as part of the YouTube channel. But, you know, as we know, Dr. Parsa has a lot of experience with lupus patients. He actually takes care of my wife who has lupus, and many others of our friends who have lupus. And he's a fantastic primary care and just general physician in general. But, you know, it's challenging to diagnose lupus, right? And there's constant questions and so forth that come up, and having access to a physician, you know, at a low monthly fee, even if you don't have insurance, is something we get questions for a lot. And so with that, the primary care is really for a low monthly fee. You can access, you know, medical or primary care medicine through telemedicine, in-home visits, especially during COVID-19. It's not necessarily good to go to an ER or to a hospital where it exposes, you know, all of us to other patients that may have COVID. So in-home has become much more popular, telemedicine and in-home visits, or if not, in the office. So obviously visit Dr. Parsa as well, you know, in the office. And so to enroll or learn more about the program, you can register early access enrollment. You can sign up and register at lfnc.org/programs. And then one of the Lupus Foundation, as well as Primary Care to You, one of us will get back to you and share more about the program. And our thought is also to have additional information on this and do a follow-up session in the next couple weeks to go into more detail about the program. But if you're interested, feel free, lfnc.org/programs, sign up, and we'll be in touch and share more information with you about this program.
Great.
Okay, so Dr. Parsa, always thank you for providing your expertise and your you know, knowledge to the Lupus Foundation and to our community. The patients are very thankful for that. And it's always great to see you and you know, share our questions that we get through the Lupus Foundation, and like I said, it's huge help for them to just get answers to some of these questions and access to you. So thank you again for participating again in the office hours and supporting the Lupus Foundation. We can't thank you enough. And to all of those out there that are watching, thank you for tuning in. And we will talk to you in a couple weeks. Again, our plan is to, you know, have these office hours with Dr. Parsa every other week. And feel free to send questions even in between these to communications@lfnc.org, and we will follow up, or we will address those questions also on our next YouTube live event, office hours with Dr. Parsa. So with that, thank you once again. Oh, was there something you wanted to say, Dr. Parsa? Did I cut you off there?
Thank you, and Lupus Foundation of the Northern California, that protecting and supporting our lovely autoimmune and lupus patients. We're always here. It's a pleasure just, you know, serving, you know, this, our community.
Fantastic. Thank you so much. And with that, we will sign off. Thanks again, everybody, for tuning in. Thank you, Dr. Parsa, and we'll see everybody in 2 weeks.
Stay safe. Bye. Thank you.